Dear viewers, today we are going to have a testimonial from one of our patients who have recently done surgery at our hospital. So today we'll be talking with Mr. Michael COSENZA. Mr. Michael COSENZA, I heard that from my colleagues that you are going to have a operation in our hospital and you had the heart problem, like the heart valve disease. So I would like to know, before you came to know that you had a heart valve disease, what are the symptoms that you have experienced by yourself?
It's an interesting question, really, Obi, because I had no symptoms whatsoever. I've ridden a bicycle now for probably almost 15 years and traveled by bicycle from Udon Thani all around Southeast Asia by bicycle. So I never had any symptoms at all. The day before this, this really came to light about the situation. I had just completed riding 100 kilometers with a friend of some friends. So it was nothing. It was normal. It was a normal day. No problem whatsoever. So I had no symptoms, to be honest. Nothing whatsoever.
That's great. Okay, so when you came to Vejthani.Hospital, when you know that you have heart problems, so definitely before confirming that, doctor, they have gone through some procedure, they have done some test, which makes you confirm that you have a heart valve problem. So can I ask you what are the diagnoses they have done here to confirm that you have the valve disease?
Here at Vejthani?
That's right.
They did echocardiogram.
Okay.
And then after the echocardiogram, they did an angiogram.
Okay.
So the angiogram was really the most important test because they used dye and inserted into, and at that time they also found out that I not only had a bad aortic valve, but I also had a blocked artery too.
Right. One more thing, you just said you live in Udon Thani province. It's quite far from Bangkok. So what makes you decided come from Udon Thani to here in Bangkok, Vejthani? What makes you decided let's choose Vejthani?
You want the truth?
Yeah.
The truth of the matter is my trust is here in Vejthani and not there. It's okay to get pills. They can pass out pills and do routine examinations. I have no problem with that. But when it comes to serious stuff, the first place I'm coming is here to Vejthani. I find the doctors to be more than excellent, the nurses to be outstanding, the staff to be wonderful. What more can I ask for?
Okay. So one more important thing, before you decided for the surgery, patient have a lot of concern. So can I ask, what was your major concern about, before the surgery?
The major concern was the cost.
Okay.
Not because I don't have insurance, but because I'd have to pay up front first before I'd file. So that was the problem was the major concern is bringing money over from the United States.
Right.
That was the biggest problem, the biggest.
Confidence. When you decided for the surgery, you must need to have a confidence about the hospital. So may I ask, how about your confidence level about the Vejthani and the nursing facilities? How would you like to say that?
Oh, they're outstanding. I mean, I couldn't ask for more. The doctors and nurses and staff are just top notch. When I finally chose Dr. PIYA,
that's right.
I did quite a bit of background investigation into him to see what he had done before. And then I felt confident this is the doctor that I want. I did exactly the same thing when I had my knee operations, and I chose Dr. COSENZA.
Right, I know him.
You know him? Okay, well, I know him well now too.
Okay, so after the surgery, how do you feel? That's the very important question. How do you feel now?
I feel okay now. I don't have enough endurance to get on a bicycle and ride yet, but I feel okay.
Okay, so what is your feedback towards the people who is watching this program now? What would you like to give the message to the audience?
I think the most important thing to do is not wait. Don't put off exams. Don't wait until you've had a heart attack, and then it becomes even more difficult because now your heart is damaged.
That's right.
And recovery is slower. On top of that, nutrition. You got to eat well. You got to exercise. And my chief form of exercise is the bicycle. How did I wind up on the bicycle so much? Was because after these knee operations here, Dr. COSENZA said, okay, you can't run. Great, it's not a big problem. You can't jog, no jumping. So I said, well, what can I do? I said, well, you can swim.
Right.
I swim like a rock. So swimming was out of the question. And he said, you can ride a bicycle. I said, okay, that's it. I'm back on the bicycle again.
You know, like you have gone through the surgery, but there's a lot of people who's afraid to go through the surgery. So what will be your message for those people who is like afraid to see the doctor because they have to go through the surgery?
Well, everybody is afraid to go through surgery. I mean, it's not an easy step, and this is not exactly simple surgery. But you've got to like balance out the, you know, what do I do? Do I put it off and wait until I have a heart attack?
Right.
Or do I do it now while I'm still healthy and able to cope with everything, you know? So you've just got to have enough confidence in yourself and enough courage to move forward, to go forward with it, and not put it off, and not put it off, because putting it off is only going to cause more problems. Right. It is not going to make it any better. It's not, with a heart valve, for instance, it is not going to get better on its own. It will not improve. There's
right.
no medicine they can give you. They can't do anything for you other than replace the valve.
That's right.
So you've got to make up your mind, and you've got to do it. Mm-hmm. You got to take the big step forward, you know, and do it.
Right. One more last question.
Sure.
How would you like to recommend Vejthani.Hospital towards your friends and your, like, you know, your relatives?
I find Vejthani to be comfortable. I find the doctors to be excellent. I find the staff to be wonderful, the nursing staff. So I highly recommend it. I highly recommend it. It's convenient. It's a convenient location. It's not in the heart of the city. It's outside the city. On top, and then they have a van service to pick you up at the airport. So when we fly in, you know, we can get a van in and get a van back out to the airport again. Right. So it's all convenience. The only downside I could say was there was no downside.
Mr. Michael, thanks a lot for your time.
Vejthani, victory for life.